I'll be speaking on this important and somewhat difficult aspect of treating myelofibrosis at a SOHO satellite symposium this year on cytopenic myelofibrosis, new approaches to tackling that. And I'll be touching on several drugs, but predominantly Pacritinib. Pacritinib is a JAK2 inhibitor that also inhibits IRAK1, and it appears non-myelosuppressive. It's been looked at in 700 to 800 patients by now in several large Phase III and Phase II trials. And we know that it retains efficacy in, for example, severely thrombocytopenic subjects who have a poor prognosis and who, very importantly, are truly difficult to treat because the approved agents, ruxolitinib and fedratinib, lack data in that setting when the platelets are less than 50 and are, frankly, difficult to use. So Pacritinib may afford those patients a very valuable new option, given that it retains its efficacy for spleen and symptoms in patients regardless of their platelet count. And then potentially even at platelet counts higher than 50. So let's say, for example, in the 50 to 100 subgroup, Pacritinib has been studied there as well in the PERSIST-2 trial, as well as in the PAC203 trial, and some of the patients in the PERSIST-1 trial as well. So essentially, it's a drug that seems to address this myelodepletive phenotype quite well. And the myelodepletive phenotype is characterized by low counts, as you would imagine from the name, and then low rather than high JAK2 allele burdens, which is a poor prognostic factor that's been known for some time. Smaller spleens, so really behaves a little bit differently, almost behaves a little bit like an MDS-MPN overlap syndrome. So this is a phenotype that's increasingly being recognized. And then I also add that, of course, thrombocytopenia is not the only cytopenia. Many of these patients are also quite anemic. So it's important to mention other drugs like Momelotinib, Luspatercept, Pelabresib. Momelotinib is a JAK1, JAK2 inhibitor best known for its ability to improve anemia beyond its efficacy on spleen and symptoms. So that could also be a very useful agent for patients with cytopenic myelofibrosis, where again, the anemia and thrombocytopenia often coexist. And so you may want a drug that is able to be safely given to somebody with low platelets, as well as improves their anemia, and Momelotinib could certainly fit that bill. And then you have Luspatercept, which is regarded as more of an anemia-specific drug, already on the market for MDS and thalassemia. Already there's some off-label use of it in myelofibrosis. So that can serve as a good partner to ruxolitinib or fedratinib to ameliorate the anemia aspect. And then finally, Pelabresib is the BET inhibitor, which also addresses all aspects of the disease, spleen symptoms and anemia. So that'll be interesting to watch. It's being developed in combination with ruxolitinib in the front line. So that could be another very interesting and synergistic partner for ruxolitinib.